I'm about to show you something that could save your life. Something most doctors never take the time to explain properly. If you're dealing with unusual stool colors that you've been ignoring, that you've been too embarrassed to mention to your doctor, that you've been hoping will just go away on their own, you need to stop right now and pay attention to every word I'm about to say. Your stool color isn't just an embarrassing bathroom detail. It's your body's direct communication system, a critical diagnostic window into what's happening inside your digestive tract, your liver, your pancreas, and your blood. Depending on what color you're seeing and what's causing it, ignoring these warning signs could mean the difference between catching a life-threatening condition early when it's treatable and discovering it too late when your options have run out. I'm Dr. Claire Whitmore. And after 20 years as a gastroenterologist, I've diagnosed colon cancer from black stools that patients dismissed as nothing. I've identified liver failure from pale stools that people thought were just dietary changes. And I've caught internal bleeding that would have killed patients within days if they'd waited even 48 hours longer to seek help. I've performed over 5,000 colonoscopies and treated thousands of seniors with digestive conditions that started with a simple stool color change they ignored for weeks or months. And I've taught thousands of patients the exact diagnostic framework I'm about to share with you that identifies what each color means, what's causing it, when it's an emergency, and exactly what to do about it. What I'm going to give you in this video is worth more than what most gastroenterologists charge for multiple office visits. You're getting a complete diagnostic framework that tells you exactly what 7 different stool colors mean for your health, the specific medical conditions each color indicates, the exact tests you need if you see these colors, the warning signs that mean you need emergency care tonight, not tomorrow, and the precise protocols for addressing non-emergency color changes at home. You're also getting information about medications that cause stool color changes that your doctor never warned you about. The specific dietary factors that create harmless color variations you don't need to worry about, and the exact timeline for when color changes become medically urgent. Stay with me through every minute because missing one piece could mean the difference between catching colon cancer at stage 1 when survival rates are 90% and discovering it at stage 4 when survival drops to 14%. This isn't theory. This is practical, life-saving information based on 20 years of clinical experience that you can use tonight to assess your own situation and take appropriate action. Let me start by telling you about 7 different stool colors you need to understand because your response depends entirely on which type you have and what's causing it. Type 1 is black terry stool, medically called melena. This is stool that looks like black tar or road asphalt, has a sticky consistency, and produces an extremely foul odor that's distinctly different from normal stool. If your stool is jet black, shiny, sticky, and smells worse than anything you've experienced before, you have melena until proven otherwise. This color appears when blood from your upper digestive tract, your stomach or upper small intestine, gets digested by stomach acid and intestinal bacteria during its journey through your system. Here's why this happens and why it's so dangerous. When you bleed somewhere in your upper digestive tract from a stomach ulcer, from esophageal varices, which are swollen veins in your esophagus, from gastritis, which is stomach inflammation, or from upper intestinal bleeding, that blood sits in your stomach getting exposed to hydrochloric acid. The acid chemically alters the hemoglobin in your blood, turning it from bright red to jet black. By the time it reaches your colon and exits your body, it looks like thick black tar. The volume of blood required to create melena is significant. You're typically losing at least 100 milliliters of blood, which is about half a cup, for melena to develop. This amount of blood loss is medically significant and can rapidly lead to anemia, shock, and death if bleeding continues. If you have black terry stool, go to the emergency room immediately. Do not wait until morning. Do not call your doctor's office and wait for a callback. Do not try home remedies. Call 911 or have someone drive you to the ER right now. Black terry stool is a medical emergency requiring immediate endoscopy to identify and stop the bleeding source. The most common causes include bleeding stomach ulcers, often from long-term use of NSAIDs like ibuprofen or aspirin, esophageal varices from liver cirrhosis, stomach cancer, and severe gastritis. Every minute of delay increases your risk of going into hemorrhagic shock where your blood pressure drops so low your organs start failing. The one exception to the emergency rule involves iron supplements and bismuth medications. If you're taking iron supplements, particularly ferrous sulfate, your stool can turn completely black, but won't have the terry, sticky texture or the horrible smell of melena. The black color from iron supplements is harmless and expected. Similarly, if you're taking Pepto-Bismol or other bismuth subsalicylate medications for stomach upset, these can turn your stool black temporarily. But if you're not taking iron or bismuth products and you see black tarry stool, this is a medical emergency requiring immediate care. Type 2 is bright red blood in stool, called hematochezia. This is when you see bright red blood either mixed into your stool, coating the outside of your stool, or appearing in the toilet water after a bowel movement. The blood looks fresh and red, not dark or black. If you're seeing bright red blood, you need to understand that this indicates bleeding from your lower digestive tract, your colon, rectum, or anus, because blood from these areas doesn't travel far enough to get digested and turn black. The mechanism here is straightforward, but the implications vary dramatically based on volume and associated symptoms. When you have a bleeding source in your lower intestinal tract, that blood exits relatively quickly before stomach acid can alter its color. The bright red appearance tells you the bleeding is happening in your descending colon, sigmoid colon, rectum, or anus. Common causes include hemorrhoids, which are swollen veins in your rectum or anus, anal fissures, which are small tears in the anal tissue, diverticular bleeding from small pouches in your colon wall, polyps, which are growths that can bleed, inflammatory bowel disease causing colon inflammation, and colon cancer. Here's how to assess the urgency of bright red blood. If you're seeing small amounts of bright red blood on toilet paper after wiping, blood streaking the outside of an otherwise normal stool, and you have no pain, dizziness, or other symptoms, this is most likely hemorrhoids or a minor anal fissure. Schedule an appointment with your doctor within the next few days for evaluation, but this doesn't require emergency care. However, if you're seeing large amounts of blood filling the toilet bowl, passing blood clots, feeling dizzy or lightheaded, experiencing severe abdominal pain, or seeing blood with diarrhea, go to the emergency room immediately. Large volume rectal bleeding can cause rapid blood loss leading to shock and death. For minor bleeding likely from hemorrhoids, increase your fiber intake immediately to soften stools and reduce straining. Target 25 to 30 grams of fiber daily through vegetables, fruits, whole grains, and a fiber supplement like psyllium husk. Take 1 tablespoon of Metamucil or similar psyllium supplement twice daily mixed in 8 ounces of water. Use witch hazel pads after bowel movements to soothe hemorrhoids. Apply over-the-counter hemorrhoid cream containing hydrocortisone twice daily for up to 1 week. Avoid straining during bowel movements by allowing adequate time and not forcing. Most hemorrhoid bleeding resolves within 1 to 2 weeks with these interventions. If bleeding persists beyond 2 weeks or worsens, see your doctor for evaluation to rule out other causes. Let me give you a diagnostic test you can do right now to assess if hemorrhoid treatment is appropriate. After your next bowel movement, if you see bright red blood, assess these factors. Is the blood only on the toilet paper or outside the stool, not mixed throughout? Is the amount less than a tablespoon? Do you have no abdominal pain, fever, or weight loss? Have you been straining or constipated recently? If you answered yes to all 4 questions, hemorrhoids are the likely cause, and home treatment is appropriate. If you answered no to any question, medical evaluation is required. Type 3 is pale, clay-colored, or white stool. This is when your stool loses its normal brown color and appears pale tan, gray, clay-colored, or even white. Normal stool gets its brown color from bile, a digestive fluid produced by your liver and stored in your gallbladder. When your stool turns pale, it means bile isn't reaching your intestines, which indicates a serious problem with your liver, gallbladder, or bile ducts. Here's the mechanism causing this dangerous color change. Your liver produces bile continuously, storing it in your gallbladder between meals. When you eat, especially fatty foods, your gallbladder contracts and releases bile through the common bile duct into your small intestine. Bile contains bilirubin, a yellow pigment from broken down red blood cells, which gets chemically modified by intestinal bacteria and turns brown, giving stool its characteristic color. When something blocks this bile flow, whether it's gallstones obstructing your bile duct, pancreatic cancer pressing on the duct, liver disease preventing bile production, or certain medications affecting bile release, your stool loses its brown color and turns pale. Pale stool is a medical red flag requiring immediate medical evaluation, though not necessarily emergency room care unless accompanied by severe symptoms. Call your doctor today, not next week, to schedule urgent evaluation. Pale stool can indicate biliary obstruction from gallstones requiring emergency surgery, pancreatic cancer which needs immediate diagnosis and staging, severe liver disease including hepatitis or cirrhosis, or primary biliary cholangitis, which is an autoimmune liver condition. The evaluation will include blood tests checking your liver enzymes, bilirubin levels, and liver function, plus imaging with ultrasound, CT scan, or MRI to visualize your liver, gallbladder, and bile ducts. If you have pale stool plus severe upper right abdominal pain, fever, yellowing of your skin or eyes called jaundice, dark urine that looks like tea or cola, or nausea and vomiting, go to the emergency room immediately. This combination suggests acute biliary obstruction, acute cholecystitis, which is gallbladder infection, or acute liver failure, all of which are medical emergencies. The pain from biliary obstruction is typically severe, constant, located under your right rib cage, and may radiate to your right shoulder blade. One medication commonly causes harmless pale stool without indicating serious disease. If you're taking aluminum hydroxide antacids like Amphogel, these can temporarily lighten stool color by binding bile in your intestines. This is harmless and resolves when you stop the medication. However, do not assume medication is the cause without medical evaluation. Any persistent pale stool lasting more than 2 days requires doctor assessment regardless of medications you're taking. Type 4 is yellow, greasy, foul-smelling stool. This is stool that appears yellow or golden, looks greasy or oily, floats in the toilet because of high fat content, and produces an extremely foul odor that lingers. If your stool is yellow, leaves an oily residue in the toilet bowl, is difficult to flush because it floats, and smells worse than normal stool, you have steatorrhea, which means excess fat in your stool. Here's what causes this and why it matters. Normal digestion requires your pancreas to produce enzymes that break down dietary fat, your liver to produce bile that emulsifies fat, and your small intestine to absorb the broken down fat. When any of these processes fails, undigested fat passes through your intestines and appears in your stool. The yellow color comes from unabsorbed bile. The greasy texture is literally undigested fat. The floating occurs because fat is less dense than water. The smell comes from bacterial fermentation of unabsorbed fat in your colon. Common causes include chronic pancreatitis, where your damaged pancreas can't produce enough digestive enzymes; celiac disease, where intestinal damage prevents fat absorption; Crohn's disease, causing intestinal inflammation and malabsorption; bile acid deficiency from liver disease or gallbladder removal; pancreatic cancer blocking enzyme release; and bacterial overgrowth in your small intestine. Less commonly, certain parasitic infections like giardiasis cause temporary fat malabsorption. Yellow greasy stool requires medical evaluation but isn't typically an emergency unless accompanied by severe symptoms. Schedule an appointment with your doctor within 1 week. The evaluation will include stool testing for fat content, blood tests for celiac disease and pancreatic function, and possibly imaging of your pancreas. If you have yellow stool plus severe abdominal pain radiating to your back, unexplained weight loss of more than 10 pounds, jaundice, or fever, see a doctor within 24 hours as these suggest pancreatic disease requiring urgent evaluation. For mild fat malabsorption while awaiting medical evaluation, reduce your dietary fat intake temporarily to decrease symptoms. Limit fat to 40 to 50 grams per day by avoiding fried foods, fatty meats, butter, cream, and oils. Choose lean proteins like chicken breast, whitefish, and turkey. Eat small frequent meals rather than large meals that overwhelm your digestive capacity. Take a high-quality digestive enzyme supplement containing lipase, the enzyme that breaks down fat. I recommend Enzymatica Digest Gold, 1 capsule with each meal. Most people notice symptom improvement within 3 to 5 days of enzyme supplementation, but this is temporary management, not treatment of the underlying cause. Let me address a dangerous myth that circulates widely. Some people think yellow stool just means you're eating too many yellow foods, or that it's normal variation. This is completely wrong and dangerous. While certain foods can temporarily tint your stool slightly yellow, true steatorrhea with the greasy texture and foul odor is never normal. It always indicates malabsorption requiring medical diagnosis and treatment. Ignoring yellow greasy stool leads to severe nutritional deficiencies because you're not absorbing fat-soluble vitamins A, D, E, and K, essential fatty acids, and adequate calories. Untreated malabsorption causes weight loss, vitamin deficiency diseases, weakened immune function, and in severe cases, failure to thrive. Type 5 is green stool. This is when your stool appears green, ranging from light green to dark forest green. If you're seeing green stool and you're worried, let me give you some reassurance. Green stool is rarely dangerous and usually has simple explanations. However, you need to understand when green stool is harmless and when it requires medical attention. Here's the mechanism behind green coloration. Bile starts out green when your liver produces it, then gets modified by intestinal bacteria during its journey through your digestive tract, turning from green to yellow to brown. When stool moves through your intestines faster than normal, bacteria don't have enough time to complete this color transformation, so it exits your body still green. Additionally, when you eat large amounts of green foods containing chlorophyll, the green pigment can tint your stool. Foods that commonly cause harmless green stool include spinach, kale, broccoli, green food coloring, iron supplements, and certain antibiotics. Green stool is typically harmless if it appears occasionally, goes away within 2 to 3 days, occurs after eating green foods or starting new medications, and you have no other symptoms like abdominal pain, fever, or blood. In these situations, no medical evaluation is needed. The green color will resolve on its own as your diet changes or your bowel transit time normalizes. However, green stool combined with other symptoms requires evaluation. If you have green stool plus severe watery diarrhea, abdominal cramping, fever, or mucus in your stool, you may have a gastrointestinal infection requiring medical treatment. Certain bacterial infections, particularly Salmonella and Giardia, can cause persistent green diarrhea. If green stool persists for more than 1 week despite no dietary cause, see your doctor for evaluation to rule out inflammatory bowel disease, bacterial overgrowth, or bile salt malabsorption. For occasional harmless green stool, no treatment is needed. If you want to prevent it, reduce your intake of dark green leafy vegetables temporarily, or spread them throughout the day rather than eating large amounts at once. If you're taking iron supplements causing green stool, continue the supplement as prescribed. The color is harmless and expected. Some people find that taking iron with vitamin C improves absorption and reduces stool discoloration, though this isn't medically necessary. Type 6 is orange stool. This is when your stool appears orange, pumpkin-colored, or rust-colored. If you're seeing orange stool, you need to determine whether it's caused by diet, medications, or an underlying condition. Orange coloration usually comes from eating foods high in beta-carotene, taking certain medications, or having too much bile acid in your stool. Foods that commonly cause harmless orange stool include carrots, sweet potatoes, winter squash, pumpkin, cantaloupe, apricots, and foods containing artificial orange coloring. If you've eaten significant amounts of these foods in the past 24 to 48 hours and your stool turns orange, this is expected and harmless. The color will normalize within 2 to 3 days as the pigments clear your system. Certain medications also cause orange stool. Rifampicin, an antibiotic used for tuberculosis, turns all body fluids orange, including stool, urine, tears, and sweat. This is a well-known side effect and completely harmless. If your doctor prescribed rifampicin, expect orange stool throughout your treatment course. Antacids containing aluminum hydroxide can sometimes create orange-tinged stool as well. However, orange stool without clear dietary or medication cause requires medical evaluation because it can indicate problems with bile acid metabolism. When your intestines don't properly absorb bile acids, excess bile in your stool creates an orange color. This can occur with bile acid diarrhea, irritable bowel syndrome with diarrhea subtype, or after gallbladder removal. If you have orange stool plus chronic diarrhea, urgency where you need to rush to the bathroom, or bowel movements immediately after eating, schedule a doctor appointment within 2 weeks for evaluation. Orange stool is not an emergency unless accompanied by severe symptoms like high fever, severe abdominal pain, or bloody diarrhea. For suspected dietary cause, simply reduce beta-carotene intake and observe if the color normalizes within 3 days. If it persists despite dietary changes and you're not taking orange coloring medications, medical evaluation is appropriate. Type 7 is mucus-covered stool. This is when you see clear, white, or yellowish jelly-like substance coating your stool or appearing in the toilet separately from stool. Small amounts of mucus are normal because your intestinal lining produces mucus to lubricate the passage of stool. However, large amounts of visible mucus, mucus appearing without stool, or mucus with blood requires medical evaluation. Here's what mucus in stool indicates. Your colon lining is covered with mucus-producing cells called goblet cells. Normal mucus production is continuous and essential for intestinal health. When you see excessive mucus, it means your intestinal lining is irritated, inflamed, or infected and responding by producing extra mucus. Conditions causing excessive mucus include irritable bowel syndrome, ulcerative colitis, Crohn's disease, bacterial infections, parasitic infections, colon polyps, and colon cancer. If you see small amounts of mucus occasionally, less than a teaspoon, with otherwise normal stool, this is typically not concerning. However, if you see large amounts of mucus, mucus with every bowel movement, mucus with blood or pus, or mucus with severe diarrhea, schedule a doctor appointment within 1 week. The evaluation will likely include stool testing for infections and inflammatory markers, plus possibly colonoscopy to visualize your colon lining directly. If you have mucus plus severe abdominal cramping, high fever above 101 degrees, bloody diarrhea, or signs of dehydration including dizziness, decreased urination, or extreme thirst, go to the emergency room. This combination suggests severe infection or inflammatory bowel disease flare requiring immediate treatment. For mild mucus without alarming symptoms, increase your fiber intake to 25 to 30 grams daily to normalize stool consistency and reduce intestinal irritation. Stay well hydrated with 8 to 10 glasses of water daily. Consider a probiotic supplement containing lactobacillus and bifidobacterium strains to support healthy intestinal bacteria. I recommend Garden of Life, doctor-formulated probiotics, 1 capsule daily. Avoid foods that irritate your digestive tract, including spicy foods, alcohol, caffeine, and artificial sweeteners. Most mild cases resolve within 1 to 2 weeks with these dietary modifications. Let me give you another diagnostic test. After your next bowel movement, if you see mucus, assess these factors. Is the amount less than a teaspoon? Is there no blood mixed with the mucus? Do you have normal formed stool, not diarrhea? Have you had no fever or severe abdominal pain? If you answered yes to all 4, continue home management and monitor. If symptoms worsen or persist beyond 2 weeks, see your doctor. If you answered no to any question, medical evaluation is needed sooner. Now let me tell you about 2 patients whose experiences illustrate the critical importance of paying attention to stool color. Robert, 68, noticed his stool had turned black and tarry. He dismissed it initially, thinking it was something he ate. 3 days later, he became extremely dizzy, standing up and nearly fainted. His wife insisted he go to the emergency room. His hemoglobin was 6.2, dangerously low. Normal is 13 to 17 for men. Emergency endoscopy found a bleeding stomach ulcer that had been bleeding for days. He received 4 units of blood and ulcer treatment. The gastroenterologist told him that if he'd waited even 1 more day, he likely would have gone into shock and potentially died. Robert's black stool was his body's warning system that he initially ignored. Margaret, 71, developed pale clay-colored stool that persisted for a week. She felt fine otherwise and almost didn't mention it to her doctor. During a routine checkup, she casually mentioned the color change. Her doctor immediately ordered urgent lab work and imaging. Tests revealed a pancreatic mass blocking her bile duct. Because it was caught relatively early through that stool color change, she was able to have surgery followed by chemotherapy. Her oncologist told her that pancreatic cancer typically isn't caught until very late stages because early symptoms are subtle. The pale stool was the only warning sign before jaundice would have developed. That single observation of stool color change allowed early intervention that gave Margaret years of life she wouldn't have had if she'd ignored it. Before I give you the action checklist, I need to talk about warning signs that mean you need emergency medical attention right now, not home protocols. If you have any stool color change plus severe sharp abdominal pain that doesn't go away, high fever above 102 degrees, vomiting blood or coffee ground material, feeling faint or losing consciousness, confusion or altered mental state, or severe weakness where you can barely stand, call 911 immediately. Do not wait. Do not drive yourself. These symptoms, combined with stool changes, indicate life-threatening conditions including severe bleeding, bowel perforation, or sepsis. If you have black tarry stool, bright red blood filling the toilet bowl, pale stool with jaundice, or any stool change with chest pain or difficulty breathing, go to the emergency room immediately even without other symptoms. The stool color alone in these situations indicates conditions requiring urgent medical intervention. Here's your complete action checklist to implement starting tonight. 1. Examine your stool at your next bowel movement. Note the color, consistency, and any unusual characteristics. 2. If you see black tarry stool or large amounts of bright red blood, go to the emergency room immediately. 3. If you see pale stool, yellow greasy stool, or persistent mucus, call your doctor tomorrow morning to schedule urgent evaluation within 1 week. 4. If you see green or orange stool, identify if you've eaten foods or taken medications that could cause it. If no clear cause exists and it persists more than 3 days, schedule a doctor appointment. 5. Take a picture of abnormal stool with your phone before flushing. As embarrassing as this seems, the visual documentation helps your doctor assess urgency and plan appropriate testing. 6. Review all your current medications. Check if any list stool color changes as side effects. 7. If you're taking iron supplements or Pepto-Bismol, recognize that black stool is expected and harmless in this context. 8. Keep a stool diary for 1 week, noting color, consistency, frequency, and any associated symptoms like pain or bleeding. This information is invaluable for medical evaluation. 9. Increase your fiber intake to 25 to 30 grams daily to promote healthy digestion. 10. Stay hydrated with 8 to 10 glasses of water daily to maintain normal stool consistency. 11. For minor rectal bleeding likely from hemorrhoids, implement the hemorrhoid protocol immediately with increased fiber, adequate hydration, and over-the-counter treatment. 12. Schedule a colonoscopy if you're over 50 and haven't had one in 10 years, or immediately if you have any concerning stool changes. Colon cancer is highly preventable through screening, but deadly when caught late. 13. If you have a family history of colon cancer, inflammatory bowel disease, or pancreatic cancer, inform your doctor about any stool color changes immediately, as your risk is higher than average. 14. Avoid using the internet to self-diagnose serious conditions, but do use stool color as a prompt to seek appropriate medical evaluation. 15. Remember that one episode of unusual stool color isn't necessarily alarming, but persistent changes lasting more than 3 days or any black or pale stool requires prompt medical attention, regardless of other symptoms.